So today I will be talking about risk factors for atherosclerosis. If you are a second prof student, the question that you will most likely be getting in your pathology exam will be enumerate risk factors for atherosclerosis. When if you will reach your final prof, the question will change to enumerate the risk factors for coronary artery disease. And when you enter your post graduation, during your rounds, if there is a patient of MI, your professor will ask you why did this patient have an MI. So then you have to tell about risk factors for MI. So when we are talking about this, all of this, we are basically concerned with one thing, and that is plaque formation. So whether it may be atherosclerosis or coronary artery disease or MI, we are talking about plaque formation. Atherosclerosis means a formation of plaque. When that plaque formation occurs in the coronary artery, then it is known as coronary artery disease. Okay, so both are basically the same thing. To give a brief overview of what are we actually talking about. So we are actually talking about arteriosclerosis. Okay, we are talking about arteriosclerosis. Arteriosclerosis means there is hardening of vessel. When that vessel is a medium artery, when that vessel is a medium and a large artery, then it is known as atherosclerosis. So hardening of medium and large arteries is known as atherosclerosis. When we are talking about small arterioles, okay, small arterioles and capillaries, that means we are talking about arterioles, arteriolo. So that is known as arteriolosclerosis. Right now we won't be focusing much on this topic. This is very important clinically, and it occurs only when there is hypertension. So it is very specific to hypertension, and it is quite serious. It is quite a serious condition. You may have heard about terms like malignant hypertension and this onion ring appearance. So all that occurs in arteriolosclerosis, which is a part of arteriosclerosis. So arteriosclerosis can occur in three forms. Hardening of vessel can occur as arteriolosclerosis. It can occur as atherosclerosis, and it can occur as Monckeberg's medial sclerosis. So this Monckeberg's medial sclerosis is not very important clinically. It is more of a pathological thing that pathologists study more about it, in which there is vessel calcification. Why is it not important? Because the lumen is normal. Okay, artery is there, the artery lumen is okay. But when we're talking about atherosclerosis, the plaque formation interrupts the lumen of the vessel, which is why it results in an MI. So only arteriolosclerosis and atherosclerosis are important. This is not very important clinically. Okay, in this topic I will be talking about medium arteries and large arteries involvement, or we are talking about atherosclerosis. Okay. So this video is only about the risk factors. I will be talking more about the atherosclerosis in the next videos, but now we are just focusing on the risk factors. So when we talk about risk factors, we can divide the risk factors into two. So there are some things which we cannot modify, which is not in our hand, and something which we can modify, which is known as modifiable risk factors. So when we talk about non-modifiable risk factors, we can also say that they are constitutional risk factors. It means that it is in our body since birth. We cannot do anything about it. So it is constitutional. So what are those things? Okay, so we can say there are basically three non-modifiable risk factors: F, A, G. So what is F? F is the family history. If you had a family history of atherosclerosis or a coronary artery disease in your family, if your parents had, then that is the most important risk factor, and this is a line pick up from Robbins. Okay, so Robbins clearly says the most important single individual risk factor for atherosclerosis is family history. And if you ask what are the genes that is responsible for atherosclerosis, then answer is we cannot point a finger at one single gene. It is a polygenic inheritance. So there are multiple genes involved. We do not know. We cannot say exactly this gene is responsible for atherosclerosis. So it is polygenic. Then about age. So at what age do we see this plaque formation? See, there is something you have to know is that everybody will be having some plaque in our coronary arteries. If you do an angiogram after the age of 40, so 40 is the cutoff given in Robbins. 40 years after this age, everybody will be having some plaque. Why some patients develop MI and some other patients do not develop MI is because that plaque formation is very minor in most of the patients. And in some patients who have had MI, on those people, see, this is artery and this is plaque. Okay, 10% plaque formation, 20% will be seen in all individuals above 40 years. Okay, when this plaque formation occurs like this, when half of the artery is obscured, this is artery and half of the artery is obscured, then the patient will have MI. So age more than 40 is a constitutional risk factor. Then we talk about gender. When we talk about gender, we say that women are protected from this plaque formation, from atherosclerosis. They are protected if they are before menopause. In before menopause, this age group, the men are more at risk. But after menopause, when the estrogen level decreases, at that point of time, the women are at more risk for developing atherosclerosis. Okay, now we have covered the non-modifiable risk factors, which was FAG, which is family history, age, and gender. Then we come to the modifiable risk factors. What can we actually modify? Okay, so what is this? This is the 3H. What do the 3H stand for? Hypertension, hypercholesterolemia, and homocystinemia. Okay, so see, this is the artery. If there is hypertension, the blood is running at a high pressure inside the vessel. It is exerting force like this on the wall. So what is vessel having in the inner layer? What is this? This is the endothelium. So if there is a pressure exerted like this or like this, what will happen to the endothelium? There is endothelial injury. So when there is endothelial injury, there is a break in the junction between these two endothelial cells, and things which should not be going from inside to outside start going like this. Okay, many things go from here to here. Platelets, monocytes, LDL. So these things should not be normally going inside. But when there is hypertension, there is endothelial injury. First injury occurs. After that, there is endothelial dysfunction, and there is an increased permeability. All these words are very important: endothelial injury, endothelial dysfunction, and increased permeability, which leads to plaque formation. Okay, so what is this homocystinemia? That was about hypertension. What is homocystinemia? We just see, homocystinemia is a very big topic and we cannot discuss it completely in this session. So just know that homocysteine is a very bad molecule, and normally this homocysteine does not exist in significant amount in our bodies. So when there is an increase in the homocysteine levels, which can be because of many reasons, we are not discussing the reasons why it rises in some people. There is, similar to hypertension, there is endothelial injury, endothelial dysfunction, increased permeability. Things which should not be going from inside to the outside start going, and then there is something which happens. There is a lot of things that will be taught about in the pathogenesis. What happens when things go from here to here? Platelets go, monocytes go. Then what happens? Then there is plaque formation and the artery becomes narrowed. Okay, so we have talked about homocysteine, we have talked about hypertension. Okay, so what about hypercholesterolemia? Hypercholesterolemia means there is increase in cholesterol levels. So increase in cholesterol, how does it occur? So cholesterol, you have to understand that cholesterol is a lipid. Cholesterol is not going freely in the blood. It is carried by lipoprotein. Okay, lipoprotein, when we talk about lipoprotein, we mean LDL, VLDL, HDL. Which lipoprotein has the maximum amount of cholesterol? That is, it is the LDL. Okay, when we say hypercholesterolemia, increased cholesterol, we are talking about increased LDL, because LDL carry cholesterol. So hypercholesterolemia, increased LDL, and this LDL is highly atherogenic. Okay, so this is a vessel and LDL is very high in the blood. This starts going from inside to outside, and just like other things, it will lead to formation of plaque. So the 3H are hypertension, hypercholesterolemia, and homocystinemia. Now we talk about the 2 I's. We talked about 3H. We can talk about 2 I's. The 2 I's are inflammation and infection. So what about inflammation? Anything which causes inflammation will lead to endothelial injury, and there is increase in permeability. So this is a diagram that I have picked from the Harrison. You can see what is this. This is the endothelium. Okay, this is the intima, this is the tunica media, and this is adventitia. When there is chronic endothelial injury, it will lead to endothelial dysfunction. So I said both these two terms are very important: endothelial injury and endothelial dysfunction. Okay, so injury. What can cause injury? We have talked about hypertension, we have talked about hyperlipidemia, we have talked about homocysteine. Okay, we will talk about other things also, but you have to just understand this, that whatever may be the cause, all of the risk factors, all of the causes will first cause an injury. Injury will lead to dysfunction. Dysfunction will occur, and then see what is happening. What is happening here? Sorry, what is happening here? These are the platelets. This is the monocytes. They are now crossing and going into the tunica intima. So there is an increase in permeability. So all of the things, just like hypertension, just like hyperlipidemia, inflammation, anything which causes inflammation will lead to increase in the endothelial permeability by causing endothelial injury. So RA, SLE, both are inflammatory conditions, and they will also lead to atherosclerosis. Cigarette smoking, same. See, smoking is written here. It's given here, smoking. Okay. Now we have talked about inflammation. We have talked about cigarette smoking. Now diabetes mellitus. How does diabetes cause atherosclerosis? So what happens in diabetes is, we are talking about either type 1 diabetes or late stage of type 2 diabetes. What happens in type 1 diabetes and late stage of type 2 diabetes? Initially in type 2 diabetes, we know that there is an increase in the insulin levels, but later on what happens is that the beta cells will ultimately decrease in number. So what happens when the beta cells will decrease in number? It will lead to a decrease in the insulin. So initially there is an increase in the insulin, but later on in the late stage of type 2 diabetes, there is a decrease in insulin. In type 1 diabetes, we know there are no beta cells. Since there are no beta cells, there is no insulin. So whenever there is a decrease in the insulin levels, what will happen is that the lipoprotein, the hormone sensitive lipoprotein lipase, will become more active. When it becomes more active, there is an increase in the free fatty acids. Function of lipase. What is the function of lipase? Lipase, the function is to break down triglycerides into free fatty acids. So when there is an increase in the activity of lipoprotein lipase, there is an increase in the production of free fatty acids. Where will these free fatty acids go? They will go to the liver. Okay, they will go to the liver, and when they go to the liver, there is formation of VLDL. See, I just now a few slides back I mentioned that LDL means high cholesterol. Okay, LDL is full of cholesterol. LDL is a lipoprotein. Lipoprotein means lipid plus protein. Lipid part of LDL is cholesterol. When we talk about VLDL carries more of triglycerides. Okay, triglycerides are basically free fatty acids. So when there is an increase in the free fatty acids, we are talking about increase in the VLDL. Okay, any increase in the lipoprotein is known as hyperlipidemia. So by this mechanism, diabetes mellitus causes hyperlipidemia, and by causing hyperlipidemia, it will lead to atherosclerosis. Okay. We can talk about few more risk factors. So type A personality. See, type A personality, I do not have anything much to explain, because Robbins also does not give why people who lead a more stressful life go on to develop atherosclerosis. So just remember that people with the type A personalities or people who live a stressful life, they are more at risk for developing atherosclerosis. Okay, see, this infection is now very important. I said that there were two eyes. Two eyes means there is inflammation and there is infection. Okay, why this is very important is because this is a repeat question. It keeps on coming and coming in your NEET exams. And the second thing is, it does not just stop at your entrance level. Even I know a senior who went on to clear his this PG, and when he went for his associate in AIIMS, the professor asked him this question only: what is the infectious cause of atherosclerosis? So you can see this is the paragraph. Okay, it is given in a very small paragraph in the pathogenesis part of atherosclerosis in Robbins, that although the circumstantial evidence has been presented linking atherosclerosis to herpes virus, cytomegalovirus, and chlamydophila pneumoniae. There is no established causal role for infection. So why these organisms cause atherosclerosis is not known, but there is a link between these organisms and plaque formation. So just remember that herpes, CMV, and chlamydophila pneumonia, these are involved. Lastly, no. Lastly, we talk about this lipoprotein A molecule. Lipoprotein A is just another form of LDL, but independent to LDL levels. It is like a very bad molecule. Okay, it is a very bad molecule. LDL is bad, but this is super bad. Okay, some patients may be having normal LDL level, but even if they have normal LDL, this is very high, it will still lead to atherosclerosis. Okay, why this is very bad? See, I said that homocysteine is a bad molecule. I said lipoprotein A is a bad molecule. When I say a bad molecule, it means basically they are very pro-inflammatory molecules. When they enter the blood, they will cause like hemostatic disturbances. They will cause an increase in the free radicals, and they will cause endothelial injury. So first step, always be any risk factor, first thing they will do is go and cause endothelial injury, which will lead to dysfunction, which will lead to increase in permeability. Okay, let's just revise quickly. So we have divided the risk factors into non-modifiable and modifiable. Okay, non-modifiable is family history, age, and gender. FAG. When you talk about when you talk about modifiable risk factors, we are talking about hypertension, we are talking about hyperlipidemia, and we are talking about homocystinemia. How can we modify? We are seeing it is modifiable. So how we have to say how we can modify? Like nobody will ask you. The question will mostly be enumerate risk factors, but just for other further information, hypertension, how will you modify? Dietary modification and drugs. Hyperlipidemia, drugs. Homocystinemia, dietary modification, weight reduction, and other lifestyle measures you can use. Infection and inflammation. So inflammation, how will you reduce? By the two I's are infection and inflammation. So this is like with SLE, with RA. So how will you modify inflammation? Steroids, you can give steroids. How will you modify infection? We can give the drugs targeting the particular organism. Okay, lipoprotein A, till now there is no drug. Okay, there can be some role of exercise and dietary modification, but till now there is no drug to decrease that has been approved to decrease the lipoprotein A levels. Cigarette smoking, how will you modify? You just stop smoking. Obesity, you can do exercise. Diabetes, you can give drugs. You can do lifestyle modification. Okay, 3H2I, lipoprotein A, cigarette smoking, obesity, diabetes, FAG. So these are the risk factors for atherosclerosis, or you can say risk factors for coronary artery disease. Okay, so just 3 questions have come from this topic in NEET PG, and that is what the question was: what is the amino acid associated with the atherosclerosis? Answer we all know, it is homocysteine. Okay. Atherosclerosis is seen with which bacteria? The answer is chlamydia. Okay, chlamydophila pneumonia, chlamydia are the bacteria responsible for atherosclerosis. If the question was virus, you know the answer is CMV or herpes. Atherosclerosis is caused by defect in HDL receptor. No, this is wrong. Okay, HDL is good cholesterol. HDL carries the cholesterol from the tissue to the liver. So it is a good molecule. See, the next option is diminished synthesis of LDL receptors. Okay, the LDL molecule, it has a lot of cholesterol. See, this is LDL lipoprotein. Inside LDL lipoprotein is, what is this? This is cholesterol. Okay, LDL goes to the tissue. This is going to the tissue. HDL was going from the tissue to the liver. Okay, so tissue has receptors for LDL. When there are no receptors for LDL, what will happen? This LDL will keep on going inside the blood. It will stay in the blood, and it will after staying in the blood, it will now go and cause endothelial injury, and start entering inside the tunica intima. So it will lead to atherosclerosis. So answer is diminished synthesis of LDL to my channel. I will be posting more such videos if you like this video asked in exams, and I will be trying to cover everything as soon as possible. Thank you.